Yes, women, once they start into addiction, they will advance quicker through the stages of addiction. They will often seek treatment younger. Men will often seek treatment because they are being coerced into treatment from like a work situation or pressure from family members, whereas women will often seek treatment saying that they feel their life is out of control. Those are often motivations for seeking treatment. Women and men will seek treatment in different locations. So we were saying about social stigma, men will often seek addictions treatment. They will often go to an addiction specialist and say, I need help with my addiction. Women will often go to a mental health professional and say, I'm struggling with mental health issues, and they're less likely to identify themselves as addicts, needing help for addiction disorders. And again, going back to the acceptability or the lack of acceptability around women having addiction versus men having addiction. And there is a lot, everything you guys are saying is bang on. It's bang on. So caregivers, yes, right? Women tend to have more of a primary caregiver role in society than men do, which makes going away to residential treatment centers for a year very impossible. And stigmatizing, absolutely. Absolutely. And so sometimes just because of life situation, that's a major barrier to treatment. Residential treatment for a single mother, for example, can just be really, really problematic if that treatment center doesn't have child-minding options. Givers of life, this one's really, really important. If we're talking about social stigma, think pregnant women and addiction. And that will prevent women from seeking treatment. It will prevent women from identifying that they have a problem. And when they do seek treatment, it will often create attitudes around them that make it really hard to get and stay sober when you're facing lots of social stigma. So that can be a challenge for people as well. And then also, women who are anyone who's in active addiction is often becomes disconnected from social resources, right? So then, pregnant women especially, it can limit prenatal care, access to resources, that kind of stuff. So what we know about treating women who are pregnant or have young children is we need to up their access to those resources, and that will actually increase their engagement in treatment services. So that's a really important piece for that. Biological differences. We actually know, we were talking about the lunar phase, or the menstrual phase. Men don't, I guess they have a little bit of a cycle, but we have a very dramatic cycle hormonally, and they do notice correlations between the menstrual cycle and relapse rates. Like when relapse happens, does have a correlation with hormonal cycles. So keeping that in mind and being able to talk about that and address that, and sometimes gender-specific groups are a much easier, safer way for women to explore those things. Women are way more likely to start into addiction after a traumatic episode, after some sort of traumatic episode. So even if the genetic predisposition is there, it's often something traumatic will happen that facilitates them into active addiction. Men, the progression seems to carry on longer, and they're more susceptible to work-related influences and reputation-related influences. Whereas women are we're more vulnerable to this kind of stuff going on. And relationship stuff. We're always a little bit more vulnerable to relationship stuff. We tend to build our identity in a different way than men. So our identity formation is more revolved around building relationships and interconnectedness, whereas men is more linear towards autonomy and career and achievement based. So we are different. We are different. Surprise!